Welcome back to the Making a Multi-Million-Dollar Med Spa podcast, where we have real conversations about what it takes to run a successful business. Thank you for joining us as we share our day-to-day successes and, even more importantly, failures and mistakes. Listen in as we host some of our peers, colleagues, and other experts in the field. We hope you enjoyed today's episode. Welcome back to the Making of a Multi-Million-Dollar Med Spa podcast. And today I have one of our top providers of aesthetic care, Meredith.
Hello.
Thanks for coming.
Yes.
Chat with me today, Meredith. She is a nurse practitioner and just an all-around superstar. So I'm really excited to talk about this topic today. The vagina.
Don't say it too loud.
I know.
It might scare people away.
I know. So, I really am so excited to talk about this procedure because it's something that, as you're very well aware, women are afraid to talk about, and yet the procedure that we offer for it is so amazing. Oh. And so today we're going to talk about diVa.
Yeah.
All right. So maybe just to get us started, think about, a couple success stories, clients that have come in, had the procedure, and why did they come in, and then what were their results?
Well, one of my favorite ones is a woman came in. I've been treating her for, I guess, since we've had it 6 years. That's a long time. She came in about a year after we've started introducing it, and it was someone that normally would never come to a med spa. She came here only for this purpose, and it's because she was genuinely struggling, and she went to her primary care doctor, her OB-GYN, with her issues, and it turns out that she had Sjogren's syndrome, which basically means you're dry. You just don't produce a lot of lubricant, eyes, mouth, including the vagina. So because you don't produce a lot of lubricant, she was getting a lot of urinary tract infections when she was trying to have intercourse with her husband. It was painful, and she was having stress urinary incontinence. So her husband actually was the one that heard about it on the radio, I think, and then sent her in, and she just very reluctantly came.
This is when Dana Wright when we were working with her,
yes.
And she's one of the top radio hosts in
yes.
Kansas City. And I love her story because sorry, I didn't mean to cut you off,
right.
but how she came in and had the procedure, and she'd been on The Price is Right.
Yes.
And so she showed us that video where she was jumping up and down The Price is Right, saying, "I'm peeing my pants,
yes.
I'm peeing my pants."
Yes.
Had the procedure and loved it so much, she started sharing it on her show.
And she was open about sharing it, but not a lot of people are.
Yeah.
And she was so great about sharing her story.
Yeah. Thank you, Dana.
Yes, thank you, Dana. It affected this lady's life, and she came in, I explained it to her. She said, "I need to think about it." But she flat out told me she didn't want to talk about anything else. She is just not someone that's going to ever get Botox or filler. And she came from a very small town in the middle of Missouri. And then she came back, also reluctantly, and I treated her. And the second time she came back for her second treatment, since it's a series of 3, she brought her husband, and they were so happy. She got a little teary-eyed.
Oh, I love
that. And she stopped getting urinary. She's been doing it very regularly. So she did her series of 3, doing it regularly every year for the last 6 years, on the same date every year. And
so just one a year is like a touch-up.
And she hasn't had a urinary tract infection. She is not having painful intercourse anymore. And that's probably my favorite one.
Life-changing.
It really is. It's a little bit. It's just different than anything else that we do.
Right. Well, that's what I was thinking. Really on the drive-in today, kind of thinking about this podcast and what we're going to talk about. And, I have felt so fortunate to be in this industry since, around 2000. And yet so much of what we do, we're not saving lives. No. We're not curing disease, but we do make such a beautiful impact, in treating acne and acne scarring and just improving the skin and making people feel better. But this is one of those procedures that's just different. Mm-hmm. It is truly life-changing.
It is, yes. So. And it's something that mainstream medicine, it's a problem in mainstream medicine, but we don't really talk about it. And there aren't a lot of options that women are comfortable with doing. And there just aren't a lot of options for doctors to offer. And this is just something in a totally different industry that really helps a lot.
Yeah.
And it helps women that may not necessarily think of ever coming to a med spa for anything else.
Right.
Which I think is cool.
I think our biggest, I'm going to say challenge is just getting the word out.
Yes.
Because to your point, and when we initially launched this, I spoke on a number of panels, and I was kind of going around Kansas City working with women's groups, and we really haven't been doing that as much lately. And back then, I mean, I was joking earlier saying shh vagina, but
oh, sure.
you know,
but
women are they're so self-conscious. They feel like they're the only one that has it. And when we launched this procedure, I did not realize that so many women suffered from stress urinary incontinence, you know, dryness, painful sex, like not having sex for months and years at a time.
Oh, yes.
And so it really opened my eyes to this condition. And, you know, it's like, I feel like we need to get back on it.
Yes.
You know, find ways to let people know.
Yes.
And so, you know, whether it's a podcast or whether it's in your clinic or whether it's just going to your own primary care doctor or OBGYN, and most of them don't know about this. Well, maybe they do now.
Some people I think know about it, but I think doctors are scared. I've heard a lot of comments about I'm here against the suggestion of my doctor because they don't know enough about it. And I think, and I did have a client come in against her doctor's advice because she just he wasn't able to offer her any other suggestions. So she's like, well, I'm going to find out information on my own. She came in, got the treatment, went back to her doctor and said it was amazing. And I don't know who it is or what it ended up being, but she did come back and say that he did more research on it instead of telling people not to do it.
I love that.
Yeah, that was probably one of the best ones that I've had come back. I'm like, okay, well, that's great.
Right. So, you know, one of my questions I always like to ask when we're looking at technology, but even now for people out there listening, what's the downside? I mean, what complications? Who can we not treat? You know, has there been anything that's gone wrong?
Right. And I think that's I think a lot of doctors are hesitant because you're putting something inside the body and it's a laser, which can be scary. But in general, it's really it's ablative, it's non-ablative, it's deep, but it's not deep enough to cause any significant anatomical damage or burn, if used correctly, with the right settings. But our tissue, especially our mucosal tissue, heals so fast. It just has the cellular proliferation just increases itself by tenfold. Just like when we do the halo on the face, it takes 7 days to heal. This takes 48 hours.
Isn't that amazing?
Yeah. It's crazy. The body can heal itself fast.
I mean, I remember when we first got it and we were like, halo technology, which, you know, it is and it isn't. I mean, it's both of those same wavelengths delivered through a different handpiece at different depths and densities and things like that. Yes. And I looked at you and I was like, oh, but my face was so hot after halo. Like, is that what I'm going to feel like? You know, down there. And we did the treatment. It was amazing. You really don't feel much.
No, and then we figured out the numbing situation, and if you use the right numbing, it really you actually don't have a lot of nerve endings inside the vagina until it's the last lower third of the introitus, which a lot of people just don't know. But the thought of a laser inside your vagina, and you got to think of women coming in having painful intercourse, and like, now you want me to put a laser inside my vagina? But I think just educating people about it and knowing, you know, the right thing to say to make people feel a little more comfortable.
I think too, I remember early on when we always, it's on our intake form or our not our intake form necessarily, but we offer it in our consultation. We talk about it in the consultation. Like, here's a list of all the procedures that we offer. Yes. And, you know, even if they've come in for Botox or hair removal, we're like, vaginal rejuvenation. And they're usually like, huh? Wow. You know, their ears kind of perk up. But, you know, I think with that treatment, sometimes what I remember, you know, talking about then, and I wonder what you think about now, is that we would bring it up and they may not do it then. They may take 3 to 6 months to come back and then say, okay, now I'm ready. And how do you feel about that now? How do you feel like the consult goes now? Are they quicker to say yes? Do you find that they do go home and think about it, maybe talk to their spouse? I mean, what is kind of the typical response?
Well, a lot of people, when I'm doing with Botox or filler, a lot of people ask me the same question: what's your favorite procedure? And I just rattle off a couple, and I always make sure I mention diVa, and I'll tell them it's vaginal rejuvenation, and they say, you said what? Did you say vaginal rejuvenation? What is that? Yeah. And then a lot of people, they first think is like the outside to make it pretty, but they're like, well, who would want that? I go, well, it's actually for, and when you explain it, it's postmenopausal women, it's post-cancer women, it's women that have had babies that just have a lot of dryness. painful intercourse, jumping up and down and peeing like Dana did. And then they're like, oh, I feel like a lot of people have that response. Well, that's not what I thought you were meaning by vaginal rejuvenation. That actually makes a lot of sense. And then almost every time, the next time they come for Botox, they'll ask me more questions.
I love that. I mean, that's so smart because it's such an easy way to bring it up. And especially when it comes from like what's your favorite treatment perspective versus just like listing it off. But it tends to always catches them when you say vaginal rejuvenation.
Yeah. And I even look at my friends, talking about my friends. A couple of my girls are like, this conversation makes me uncomfortable. And I'm like, what makes you uncomfortable about it? And then they kind of open up like, oh, what is that? It does make sense, I guess, if you're having painful intercourse.
Are you struggling with high turnover? Do you need expert training for your providers? Are you ready to take your business to new heights? Let Mint Aesthetics provide you with the knowledge to meet your goals, expand your practice, and get amazing results. Mint offers aesthetics training through online e-courses, hands-on training, virtual training, and business consulting. Whether you're a beginner or more advanced, you'll gain a competitive edge by accessing cutting-edge e-courses designed exclusively for professionals like you. Imagine the return on investment as you master advanced treatment techniques, refine your post-care protocols, and expand your knowledge base to offer unparalleled treatments to your clients. It all begins with quality training. Don't wait any longer to invest in your clinic. Join the ranks of successful aesthetic professionals who have transformed their careers with Mint Aesthetics training programs. Visit our website at mintaesthetics.com to book your training or gain access to the online e-course catalog. Your team and business will thank you.
Right.
It's worth talking about. Like, okay, that makes, just to get the word out there and people feel comfortable about it, I think is the hardest thing.
Yeah, for sure, that piece. And then on our side as clinic owners and providers, it seems like there was a little dip in the kind of industry talk.
Oh, yes.
It boomed. It was, every company was launching a device, and then, it really quieted down, and they, whether, FDA things and inquiries, and I think all the companies are kind of reevaluating. But what I've noticed, and we haven't talked about, but is an uptake in the number of treatments that we're doing. And so like the first half of this year, we've done more than what we did all of last year.
Oh, really?
Yeah.
Oh, wow.
Yeah. So
that's great.
Isn't that fun?
That is fun.
I know. So I think, it's also one of the reasons why I wanted to do or focus on the podcast is just bring awareness out again, get it going at a clinic level. So for you guys listening out there, check it out. We don't make anything. If you call Sciton and inquire about the technology, we just feel like it's helped so many of our clients that why not help more women around the world?
Oh, and I think, and the other thing, I think a lot of the providers, every provider, even estheticians, I get a lot of referrals from them because they're talking about it too.
Yeah.
It's everybody.
Right. And I think it's one of those treatments that offer to your team. I know that many clinics have different ways of offering treatments. Some don't give them a discount at all. Some do like 20% off. The Aestheticare, our team can have all treatments at cost. The first time they have the treatment, they have it for free. And then, if they were to have diVa every year, they would just pay for the cost of the disposable. So I think, it's the best testimonial you can have. And why not offer those amazing things to your own team to help them in their lives?
It helps tremendously because then you can't really, unless you can explain it from a personal level, it's hard to get them on board.
Right.
Yes.
You mean the team or the client or both?
Yeah, okay. the provider, when you're treating it, because we all have clients we're really close to, and some people are comfortable talking about it with other providers. And unless you can explain it, that you've had it,
right, then
it's hard to just kind of just reiterate what's on a piece of paper. But when you really truly explain what your experience was, people get it.
Yeah. And be able to say, no, it really didn't hurt.
Yes,
and
yes.
I really didn't have awful downtime.
Yes.
And everyone here everyone has had it.
Almost.
At least once. Yeah. Unless you're, 20 years old at the front desk. You probably don't need it.
Yes.
Okay, so I feel like we've covered quite a bit about diVa. I think, who, in terms of like, any other downside? I mean, is there any complication that we've had I mean, I can't think of any.
I mean, I always go over if you're prone to urinary tract infections, or you're prone to bacterial vaginitis, or you're prone to a yeast infection, you may have an issue. I think in the last 6 years, I've had maybe 2 or 3 people come back with, and we've treated a yeast infection, but that could be related to so many different things. But other than that, I have not had any significant issue that can't be just treated.
And how is the treatment for you? Because I always like to look at for our team, does it take you forever? Are your shoulders worn out at the end? How long does it take? That experience on your side.
Well, when this all came out, and like you said, some other companies were coming out with certain things, and I heard their protocol, I thought, there is no way that you're going to be doing any of 30-minute treatments. No way.
Right.
This is a quick treatment. I think I book about an hour to do the treatment. That's pulling blood, numbing, everything. I'm in the room the whole time, talking, making the client feel comfortable. The actual treatment part, I want to say, is like 8 minutes.
I was going to say, I think this isn't like 3 minutes, and then you may do 2 passes. By the time you do 2 passes, 8 minutes, less than 10 minutes.
Yeah, it's definitely less than 10 minutes. And once you tell the client that too, they are like, oh, well, that's nothing.
Right.
And it really is. People don't believe me until they do. It's for a provider and for the client. It's probably one of the easiest things that we do.
Well, that's fun.
Yeah.
I love that.
Yeah.
Oh, okay. And so we talked a little bit about the downtime, but what do you tell your clients to expect for downtime?
Could be a little bit of cramping, especially if you're not used to having a period anymore. Cramping, a little bit of discharge, a little bit of bleeding. Do not submerge in water for 48 hours, and nothing inside the vagina for 48 hours. So no intercourse, no tampons. Don't try and clean the area with a shower head or anything like that. That's really about it. The things they'll experience besides the cramping and a little bit of discharge is sometimes you can have a little bit of itching on the outside, because you can use this treatment for scar therapy if they've had an episiotomy. So that is actually more, it's a different type of tissue, so it does take a little bit longer and it can be itchy. But that's really about it. And then even with that, it's still less than 3 to 4 days.
Right, 48 hours.
Yeah.
I can do anything for 48 hours.
Yeah.
Except for push-ups.
Yeah. Not even.
Yeah. Yeah. Oh, well, I love it. Meredith, thank you so much for your time today. You're just so amazing. I hope you know that. I know, me too.
That's good. That's really good.
Yeah. So if you are interested, you of course give Sciton a call. They can go through additional information with you. If you have diVa and you're just looking for training, we'd love to have you out at Mint Aesthetics. You can work with the one and only Meredith. So give us a call, reach out to Ben at mintaesthetics.com, or check out the website, and you can contact us through the website as well. So thanks for checking in with us today. Thanks for Meredith for being here, and we'll chat with you later.
Thanks for listening to today's episode. We would love it if you left a review to help other providers and clinics find us. Also, if you want more information about anything we discussed in this episode, check out our show notes. Until next time, this has been the Making a Multi-Million-Dollar Med Spa podcast.